Welcome to Raaonline. Now we'll discuss microcytic anemias. How do you approach and how do you manage? I am Dr. N. Sukanya. Now going into the presentation. So first, before entering, what is the definition? What do you define as microcytic anemia? So in RBC cell counter or the automated cell counters, it gives MCV. We know the mean corpuscular volume or MCV is normal value is 80 to 100 microns. So when MCV is less than 80, we call it as low MCV or microcytic anemia. So in the peripheral blood smear, how do you say it as microcytic anemia? So the normal RBC diameter in the peripheral blood smear is 7 to 8 microns, which approximately is the size of the nucleus of a small lymphocyte. So here I have shown a peripheral smear picture. So if you see here, this is the small lymphocyte. Okay, so look at the nucleus of the small lymphocyte and compare it to, these are the RBCs, red blood cells. So you have to compare with the red blood cell size. So this is the nucleus of the small lymphocyte. So if you see the RBCs are smaller, so these RBCs are smaller than the nucleus of the small lymphocyte, and you call these cells are microcytic. Okay, and what is hypochromic? So in automated cell counters, when MCH and MCHC is low, then you call it as hypochromic cells. In case of peripheral blood smear, this is the central pallor of the RBCs. Normally, the central pallor of a normal RBC should be approximately 1/3 of the cell diameter. So, cells which have a larger or wider central pallor are called as hypochromic cells. So, this is how we define microcytosis and hypochromia. Okay, MCV of less than 80, or in a peripheral blood smear, the RBCs are smaller than the small lymphocyte nucleus, and if the central pallor is wider, we call it as hypochromic cells. Now, what are the causes of microcytic anemia? Just remember this mnemonic TICS. Okay, so T for thalassemia, I for iron deficiency anemia, C for anemia of chronic disease. Of late, it is called as anemia of inflammation, and S for sideroblastic anemia. So, these are the major causes of microcytic anemia. So, before going into the approach, very importantly, you will distinguish these various causes of microcytic anemia based on the serum iron studies. So, we will dwell sometime in this. Okay, so what is this serum iron studies? What all comes under serum iron studies and how do you interpret them? So first is the serum ferritin. You know, serum ferritin is the storage protein of iron. It is also an acute phase reactant, so it increases in the presence of inflammation, infection, malignancies, etc. So in case of iron deficiency, there are a low ferritin level of less than 30 nanograms. So a ferritin level of less than 30 nanograms is suggestive of iron deficiency. What happens in anemia of chronic disease? Because it is an acute phase reactant, the serum ferritin levels are going to be elevated. Okay, whereas in case of thalassemia, it is going to be normal. In case of sideroblastic anemia, because it is iron storage disorder, serum ferritin levels may be again elevated. Now coming to serum iron. Very important is the serum iron, it has a diurnal variation. So, always the sample should be taken after the overnight fasting. Okay, so this measures the circulating iron mostly which is bound to the transport protein of iron, which is transferrin. And serum iron obviously will be low in case of iron deficiency anemia and also in anemia of chronic disease. The serum iron levels are low. Sometimes if the patient is on iron supplements, the serum ions may be falsely normal also. That is the fallacy of serum iron. Next is serum transferrin. Serum transferrin is also reported as TIBC, that is total iron binding capacity. So what is transferrin? Transferrin is the circulating transport protein of iron. That is how iron circulates in the serum as transferrin. So this transferrin will be increased in case of, because the cell wants to avidly bind to more amount of iron. So the soluble transferrin receptors all gets expressed more, and the serum transferrin or the TIBC is increased in case of iron deficiency, but it will be decreased in case of anemia of chronic disease. Okay. And what about this transferrin saturation? Of course, transferrin levels are increased, but transferrin is not saturated adequately with serum iron in case of iron deficiency. So, what is transferrin saturation? It is a ratio of serum iron to TIBC. So, serum iron divided by TIBC into 100 gives a transferrin saturation. So, as expected in iron deficiency anemia, there is low transferrin saturation. The normal values ranges from 25 to 45% of transferrin saturation. Any value less than 19 is suggestive of iron deficiency. Serum transferrin saturation will be low in case of anemia of chronic disease also.